think there's actually three parts to this problem, in my view. And I'm not sure if they're independent pillars or overlapping Venn diagrams, but the three parts that I see, number one, is obviously the business challenge, that a company wants to be a commercial success. And I think that you spend a good part of your book on the challenges, and we'll talk more about that in a minute. But it's the business challenge of becoming a commercial success. And it's either an offshoot of that or separate pillars of part of that, because I think the other two parts are, number one, are the clinical outcomes piece of it. And, David Nash, who's the founding dean of the Jefferson College of Population Health, he just retired as the founding dean of that, has this great quote. I give him full credit for it, but I steal it all the time. Which is, no outcome, no income.
Yep.
And again, we'll come back to, I want to list the three things, then we'll come back and talk about each one of these in a little bit more detail, I think. And then the third factor, I think, really is health system workflows. And really defining the roles and responsibilities of healthcare, identifying the challenges that healthcare faces, and how do all these three interlace, and really how do you take these in terms of clinical and business skills and bridge them together. So that's kind of how I see it. From the business challenge, let's talk about the business challenge aspect of this. So there's three parts. I don't know if it's pillars or overlapping Venn diagrams, but to be a commercial success, you and I both know there are companies out there that build solutions looking for a problem. And that's really not the best way to do it. And so that's one issue with the business challenge to become a commercial success. The second area, I think, is in terms of co-development. And I've seen many companies where they build their solution or their product sort of in isolation. And I think one of the things you need to, it's a mind shift with healthcare, because you really have to build it the way clinicians think. If you don't have that way clinicians think to overlap it with the clinical presentation, again, you're going to fall short, and you need to be concerned about that. And then finally is the clinical validation. So again, that part of the Venn diagram that we need to go talk about the Venn diagram. And I think one of the best way to sum it up as I see it in terms of the business challenge is that a lot of companies will think of it as a product out there. And I think that's a mistake when it comes to healthcare, because what healthcare is looking for is not a product. They're looking for a solution. And if you continue with a product, that may not be solving my problem. And so what I really need from you is a proven solution of how do I incorporate this into my system. So that's the one business challenge piece. Let's talk about the clinical outcomes piece of this. The clinical validation piece is very critical. No outcome, no income. And I think a lot of companies are surprised that, we have this great widget, let's go sell it. And the very first question you're going to get is, show me the data. Because think about it, if you're a new company trying to get traction, no one is going to take a risk on you without clinical data. And, I don't mean that it needs to be a large 2,000 patient randomized clinical trial, but you do need to show a pilot to demonstrate that what you're offering really does what you say it's going to do. But that does entail a number of things. It entails writing the study protocol, getting IRB, going through the IRB. It does not mean you may or may not need to get informed consent based on what you're really trying to demonstrate with it. But having that IRB piece of paper, I think, is very important. Getting the data, analyzing the data, having go, no-go decisions, identifying the metrics you're going to measure and assess for success or failure is important.